Imagine witnessing someone collapse suddenly. Would you know what to do? Every second counts in a cardiac emergency. The American Heart Association described CPR, or cardiopulmonary resuscitation, as a life-saving technique that can double or even triple survival rates if performed correctly. Whether you're a healthcare professional or a bystander, knowing CPR can make the difference between life and death. As an aspiring nursing student and someone who is already CPR certified, I have studied the proper steps of CPR and understand its critical role in emergency situations. Today, I will guide you through the correct execution of CPR, including assessing the situation, performing chest compressions, and delivering rescue breaths. Let's start by understanding the key steps to take before beginning CPR. The first step is to ensure the scene is safe and check for responsiveness. Tap the person and ask if they're okay. If no response, call 911 and get an AED if one is available. Now, it's important to note that if you are alone and nobody is near, you must call emergency services before beginning CPR. If someone is nearby, instruct them to call for help and get an AED if one is available. Next, you are going to want to check for breathing and pulse. Look, listen, and feel for breathing. Look to see if you can see the patient's chest rising. Listen to their chest for air and feel for a pulse. If no breathing, begin CPR immediately. Now for the fun part, how to perform chest compressions. In 2024, the Ready Care Clinic described this as the most effective method in saving lives. To start, make sure the patient is on a firm, flat surface like this one. Then you are going to place the heel of your hand on the center of the chest. You want to make sure to interlock your fingers and get a nice firm hold so that you can continue CPR. Keep your arms straight to maintain proper depth with the compressions. Use your body weight to push hard and fast, at least 2 inches deep. An easy way to think of that depth is to think of the length of a credit card. In 2025, the American Red Cross explained that in order to complete precise chest compressions, you must maintain a steady rhythm of 100 to 120 compressions per minute, as well as ensuring there is full chest recoils in between compressions. It is also important to note that if another person is available to switch with you, you must rotate since CPR can be extremely exhausting. Make sure to switch quickly to maintain effectiveness. The last and final step is to deliver rescue breaths. First, you are going to want to open the airway using the head tilt and chin lift method. You're going to pinch the nose and tilt the head back. And then you want to take a normal breath and have a complete seal over the person's mouth. Provide 2 effective breaths and watch the chest rise. After giving the rescue breaths, resume chest compressions immediately with cycles of 30 compressions and 2 breaths until professional help arrives. If using an AED, make sure to follow the prompts. Now that we've covered the proper steps, let's review why CPR is essential. Miranda Smith, one of my close friends, watched as a semi-truck hit a Mini Cooper in the passenger side of the car. As she got closer to the scene, she saw an older lady and the semi-truck driver pulling the teenage girl out of the car. Miranda watched this lady start CPR on the girl. She knew she had to quickly make a decision, whether or not to jump in and help or let the lady in the scrubs handle it. She watched as the lady's compressions became weaker and made her decision. After about 6 to 10 minutes of rotating, the paramedics had arrived. The cops needed a statement from Miranda and the lady, and then they were free to go. They never found out if that girl survived, but at least they knew they helped increase her chances of survival. Stories like this remind us that emergencies can happen anytime, anywhere, and having the skills to respond can truly make a difference. Let's take a moment to reflect on what we've learned today. We've discussed the critical steps of CPR, assessing the situation, performing chest compressions, and delivering rescue breaths. According to the American Heart Association in 2022, each of these actions can significantly increase a person's chance of survival. Earlier, I asked you what you would do if someone collapsed in front of you. It's a scary thought, but with the right training, you can be ready to save a life. CPR is a skill that empowers you to save a life. Take the time to learn it, practice it, and get certified, because you never know when someone might need you.